Hi, we are the Rabies group. This is our presentation. My name is Krista.
My name is Daniel.
My name is Derek.
And my name is Shanti. So while studying for rabies, we found a few facts that we thought we should share. One is that Joseph Lennox Pollen is the one who found that rabies can transfer from an animal to a human, and that was discovered in 1932 when a bite was done by a bat, what they called a vampire bite. The second one is that rabies is named after a Latin word, which means rage. And that is because the animal that usually is going through rabies has a lot of rage, is very aggressive. And the last one that we wanted to share was that 95% of deaths of rabies are from Africa and Asia.
I'll be covering the etiology of rabies. The rabies virus belongs to the Lyssavirus genus. As the name suggests, these viruses are rod-shaped. They have one end that is rounded and are often referred to as a bullet shape. Each virus particle is up to 100 nanometers in diameter and 400 nanometers long, but the size is variable. In the terms of virus genomes, it is a negative sense virus, meaning that there's a single-stranded RNA, nucleic acid molecule, that has the opposite sequence of messenger RNA and so cannot be translated into protein until it has been copied. This has important biological implications for the virus with negative sense RNA genomes. Since cells have no biochemical mechanism to copy RNA, every single negative sense RNA virus must carry within it the virus particle, an RNA-dependent RNA polymerase, or replicase as it is frequently called, or the virus genome will be biologically meaningless once in the host cell. This is also an envelope virus, meaning that there's a lipid and protein structure called the envelope that is derived from the host cell membrane. The envelope plays many roles in viral infection, including virus attachment to cells, entry into cells, release of the capsid contents into the cells, and packaging of newly formed viral particles. The capsid and envelope are also responsible for the transfer of viral genetic material from one cell to another. These structures also determine the stability and characteristics of the virus particle, such as resistance to chemical or physical inactivation. Next slide. I'll also be covering the reservoir for rabies. Over the last 100 years, the epidemiology of rabies in the United States has changed dramatically. More than 90% of all animal cases reported annually to the CDC now occur in wildlife, whereas before 1960, the majority were in domestic animals. The principal hosts in the United States today are wild carnivores and bats. Raccoons account for the most, contributing 36% of all animal cases, followed by skunks at 24%, bats 23%, foxes 7%, and other wild animals including mice, rats, and rabbits accounting for 2%. The great reduction in human cases is largely the result of vaccinating dogs against rabies. Millions of dogs are vaccinated each year in the United States at a cost of over $300 million per year. Next slide.
So signs and symptoms that necessarily show right away. They can have an incubation period of 1 to 2 months. Signs and symptoms can show faster or slower, really just depending on where the location of the wound is. The closer to the brain, the faster the effects show themselves. Next slide. So here are some signs and symptoms of rabies. Signs being delirium, fever, excessive salivation, partial paralysis, vomiting, symptoms, headache, confusion, weakness, fatigue, nausea, and insomnia. These are all signs and symptoms for humans. Dogs have the same symptoms with a few others added, such as the change in the tone of bark, drop jaw, the inability to swallow, which causes the foaming of the mouth, which rabies is still well known for. This disease is an acute disease that can lead to death quickly if not treated after infection. Next slide.
So the transmission of rabies, according to the CDC, all species of mammals are susceptible to the rabies virus, but only few species are important as reservoirs for the disease, like was discussed before. The United States has a distinct strain of the rabies virus that has been identified in the raccoons, skunks, foxes, and coyotes, and even several species of bats. So I like this picture. It just shows kind of like specific bullet points about the rabies virus. So almost all transmission is by bite, 50 times greater risk than a scratch. One human case may have been acquired in a laboratory transmitted by aerosol. In wild animals, rabies can be transmitted transplacently. Transplants in human, it's possible to transfer the rabies virus to the next human through transplant. Human to human has never been officially confirmed, and the rabies virus is never isolated from the blood. How it begins is the transmission of the rabies virus usually begins when the infected saliva of a host is passed to the uninfected animal, and it is usually through the bite from the virus-containing saliva of the infected host. Although there are other types of transmission that have been more hard to document, such as the contamination of the mucous membranes, like the eyes, the nose, the mouth, the aerosol transmission that was discussed before, and also the corneal and organ transplants. So this is just an example of a raccoon exposure to the rabies virus. So the raccoon is bitten by a rabid animal. The rabies virus enters the raccoon through infected saliva. The rabies virus then spreads through the nerves in the spinal cord and the brain. The virus incubates for approximately 3 to 12 weeks, so 1 to 2 months, that was discussed before. The raccoon usually has no signs of the illness during this time. Then when it hits the brain, the virus multiplies really fast, and it passes to the salivary glands, and from there, the raccoon starts to show signs of the disease. And then when it starts to show signs, the infected animal usually dies within 7 days of becoming sick. And then this is just a little poster that kind of shows the specific virus transmission, the treatment, and the fatalities. So it's usually from the saliva. 99% of human cases are from dog bites. And once it hits the brain, it's fatal. The treatment is seeking medical help and making sure the wound is cleaned. So the rabies virus usually affects more rural communities, so mostly like Asia and Africa, and then about 1 death every 15 minutes, and 40% of the victims are children younger than 15. Next slide, the treatment.
I will be discussing the treatment of the rabies virus. In the history of 1885, Louis Pasteur and 2 colleagues successfully developed a vaccine and treated a 9-year-old boy named Joseph Meister, who had been bitten by a rabid dog. With Pasteur successfully creating a vaccine for humans, other researchers and scientists have taken a different angle in fighting the rabies virus by vaccinating dogs. In 1979, the Van Heuling Research Laboratory of the Silliman University Medical Center in the Philippines produced a vaccine for dogs that grants them immunity from rabies for 3 years. This program has also been used as a model to fight rabies for other countries with the help of the World Health Organization. Today, there are several types of vaccines administered to the public for the rabies virus. The human diploid cell rabies vaccine, also known as HDPV, was brought up in 1967. It is an inactivated vaccine that has been given to well over 1 million people as of 2006. There have been other vaccines developed that are less expensive and newer than others, such as the purified varicella rabies vaccine. This particular vaccine uses the attenuated Worcester strain of the rabies virus and uses the varicella line as its host. To help vaccinate the wildlife, the vaccine has been injected into foods that other animals, such as raccoons, foxes, and coyotes, would eat. The injected food is then dropped into areas by airplane. This does not mean every wild animal has been vaccinated. Anyone who is bitten by a wild animal should still use extreme caution. When one is bitten by a rabid animal, the wound itself should be cleaned immediately and then taken to a doctor. The doctor will then determine what steps to take to ensure any possible infection is properly cared for. It is recommended that someone who has never been vaccinated for rabies and is exposed to it should get 4 doses of a rabies vaccine, the first one immediately and the rest throughout the next 2 weeks. A shot called rabies immune globulin is also recommended to be given to the patient at the same time as the first dose. A person who has been previously vaccinated should get 2 doses of rabies vaccine, one immediately and the other 2 days later. The rabies immune globulin won't be needed at this time. Next slide. For prevention, there is no law requiring people to become vaccinated for rabies, but it is highly recommended for anyone who is at a higher risk of exposure or constantly working around animals, such as veterinarians, canine handlers, zookeepers, and microbiologists. Pets, such as dogs and cats, are now required by law to receive the rabies vaccine between 12 to 24 months of age, and again, every 1 to 3 years. This protects not only their owners, but others that they may come in contact with as well. If they are bitten by possibly rabid wild animals, the rabies vaccine will protect them. Next slide.
Now that we've learned a little bit more about the rabies virus, we'd like to share a case study. The patient, a 57-year-old man who had lived in France for 15 years, had recently returned from a 6-month stay in Mali, West Africa. He presented with a fever close to 101 degrees with abundant sweating, generalized pain, and a slow heartbeat of 40 beats per minute. The case report characterized brain images studies as unremarkable. The patient tested negative for herpes simplex 1 and 2, HIV, syphilis, and epilepsy, among other conditions. However, 2 days after ICU admission, the patient developed bouts of hyperactivity, disorientation, delirium, with thoughts of impending death associated with percussion ideas, alternating with periods of drowsiness and returns to normal behavior when he seemed aware of his disorder and criticized it, the investigator reports. Hypersalivation was remarkable, and the patient occasionally spat on ICU personnel. Skin biopsies and salivary swabs obtained on day 13 in the ICU confirmed the diagnosis of rabies. The strain, which was identified by the National Research Center for Rabies, Paris, was known to be circulating among dogs in West Africa. The case's complexity and the large number of tests undergone had left 158 healthcare professionals potentially exposed to the disease via the patient's bodily fluids. Following evaluation of these personnel, 52 were deemed at risk and were vaccinated against rabies. 2 of them, who had been in close contact with salivary fluids, also received rabies immunoglobulin. Next slide. That concludes our presentation. Here are a few references if anyone cares to further research or learn about the rabies virus, but we hope you've enjoyed our presentation.